Hi guys, we're here to do a Q&A today. It's May 7th, 2020, and a lot of you have sent in some questions for us. So Dr. Hagen, Dr. Beyer, and myself are going to try to answer them for you.
Hi, this is Dr. Matt Beyer from Hagen Beyer Seasonal Ear, Nose, and Throat Clinic. Today's question is from Lacey. She asks, how do I know if my child has an ear infection and when should I see an ENT? Good question, Lacey. The signs and symptoms in a young child of an ear infection include tugging at the ear, fever, irritability, decreased appetite. In an older child, they may complain of hearing loss or ear pain. A pediatrician or family doctor can treat acute ear infections, but when these infections are recurrent or persist, then it's recommended that they see an ear, nose, and throat doctor. Thank you for the question, and stay healthy.
Abby asks, what precautions are we taking at our office to prevent the spread of coronavirus and prevent our patients from catching it? Well, Abby, we do know from science that two ways that coronavirus spreads is through respiratory droplets, talking, coughing, or sneezing, and with close interaction with other people. And the other way that it spreads is by touching contaminated objects. So, very straightforward. The first thing we're doing is not having our patients wait in the waiting room. That way they're not in close contact with each other. We call you in from your car straight into the exam room, and it's just you and a loved one if that's necessary, or a parent and a child and nobody else. And that avoids the contact in the waiting room. Once you're in the exam room, we ask that all of our patients wear a mask. That way any respiratory droplets from talking or coughing or sneezing are not transferred to the doctor. The doctor also wears a mask, and so does the nurse, so they're not transferred back and forth. In addition, in between each patient encounter, in the exam rooms and also in the checkout area, we are intensely disinfecting everything by wiping it down in between patients. So the chances of you catching coronavirus here at our office are extremely low.
Today's question is from Sean. She asks, does an ENT treat and diagnose thyroid problems? Yes, Sean, we do. We do ultrasounds, thyroid biopsies, and surgery for thyroid nodules or masses. If a thyroid problem requires medication, then we oftentimes coordinate that with the patient's primary care doctor or an endocrinologist. Thanks for your question, and stay healthy.
Ronald has written in asking, is there a way to permanently cure his allergies? Well, Ronald, allergies are your own body's immune system overreacting to harmless substances, such as dog hair, cat hair, or dust. Well, what we need to do to make you be cured of those allergies is to make your immune system stop reacting to them. We call this disease modification. We can reduce how sensitive you are to these things by, say, 50% or 90% or even almost totally. The only way to do this is through something called immunotherapy. And the two ways that's done is by slowly introducing the substances under your tongue to desensitize you, or by giving it to you in shots, such as allergy shots that you've heard of. Under the tongue, we call that sublingual immunotherapy, or allergy drops. As a shot, we call it subcutaneous immunotherapy. So both of those are available to you. Rachel has written in asking, how do I know if I have a cold, a sinus infection, allergies, or is it the COVID-19 coronavirus? Rachel, there are some overlaps between all of these conditions, but there are some distinctions, and let's talk about that. A cold is simply a virus that you catch, and it can cause symptoms such as stuffy nose, runny nose, scratchy throat, and maybe a mild cough. Allergies are your body's immune system overreacting to something in the air, and it's very similar to the reaction in your body as a cold, so the symptoms overlap. You may have congestion in your nose, cough, runny eyes, or runny nose. The main difference, how we tell the difference between a cold and allergies, is the history. In other words, if you catch this cold or these cold symptoms every spring, we know it's probably not bad luck. We know it's probably something in the air that your body's reacting to. If these symptoms have been plaguing you for several weeks, we know it's not a cold because the vast majority of people get over their little cold in 5 to 7 days. Now, let's talk about sinus infections. Colds and nasal allergies can both lead to sinus infections. So if you have symptoms that are persisting or getting worse, or your face is hurting, or you're blowing discolored mucus after 4 or 5 or 6 days, you most likely have a sinus infection. That's the time that you would maybe need to take some antibiotics, maybe come to our office, have the sinuses washed out to eliminate all the infection, or maybe take some other medications that we could offer to you. Now, coronavirus is a whole different animal. It is a type of infection that you catch, but there are some hallmark symptoms of coronavirus that have been identified by scientists looking at it. The main ones are shortness of breath, severe cough, fever and body aches, and loss of smell, which leads to loss of taste, which is present in about 70% of patients and can definitely tip us off to thinking it's coronavirus. We can order a test for you. If you have any of those symptoms, you can call us and we can get a test ordered for you and find out if you indeed do have coronavirus. But thanks for your question, Rachel.
COVID-19 is a serious viral infection that can be fatal in high-risk patients. With appropriate concern and healthcare resources focusing on COVID infections, it's easy to overlook or delay treatment for other non-COVID problems. Non-COVID problems can be still treated as long as appropriate precautions are taken. At our offices, we're implementing precautions to reduce the likelihood of viral infections. It is important not to delay treatment, especially if you have symptoms such as chronic ear pain, a persistent sore throat, difficulty swallowing, chronic hoarseness, a neck mass, or non-healing ulcer. If you're concerned about coming to the office, a telemedicine appointment can be made. We want everyone to stay healthy and be safe. Thank you.